Hello and welcome, everyone. My name is Chris Hanberg. I'm the Executive Director of Indie Pride. My pronouns are he, him, his. I'd like to thank everyone for joining us tonight as we discuss local LGBTQ leaders' response to the COVID-19 pandemic. We're very happy to welcome Angie Martinez from Shalom Health Center and Dr. Darrin Johnson from BU Wellness Network. Tonight, we're going to have an opportunity for all of us to learn how these community leaders have adapted their efforts in the face of the current crisis and receive information on resources that are offered and how you can support their efforts. This event is open for you, the community, to ask questions. I'd like to welcome everyone to use the chat feature on Facebook and on YouTube, and we'll discuss your questions and comments during this discussion. I'd like to give a special thanks to Ball State University for sponsoring this educational event. Dr. Darrin Johnson, Angie Martinez, welcome and thank you for being here. I hope you're having a good night. How are you doing?
Doing well.
Excellent. Well, if you don't mind, the first question I have is, could you tell us a little bit about yourselves and the organizations you're representing?
Why don't you go first?
All right. So good evening, everybody, and thank you so much for having me be a part of this conversation. I'm Darrin Johnson. I'm the Executive Director of BU Wellness Network. I have been the Executive Director of this organization for the past 2 years. Still pretty new to Indy. Lived in Indy for 2 years. Originally from Charlotte, North Carolina. I've worked in HIV space for about 13 years, primarily in the community-based setting. Did some research at the University of North Carolina at Charlotte, and now I am here at BU Wellness Network.
Thank you.
Hi, everyone. Martinez, because program manager for Shalom Healthcare Center. We are a qualified healthcare center located in the west side of the town. We're here with primary whether you're locally and
So Angie, we are having a very hard time hearing your audio. If you might want to check some connections or make sure that your microphone's turned on, because we kind of lost everything you just said. But so I'm going to let you do that and just talk with Dr. Darrin Johnson for a second. You know, I was in a meeting last week, and I was looking at the agenda for that was the last meeting. The previous meeting was in January. Mm-hmm. And the first question I asked is, what are you excited about in 2020, looking ahead? And if I knew then, so I guess the question is, what were you excited about? And is there anything that's given you hope so far?
Well, it's 2020. I mean, every day that we have an opportunity to do something different. So that's exciting and one. I think that we have faced so many challenges this year. Of course, COVID being the biggest challenge. That, you know, we are a community that, you know, typically, you know, knows how to come together to use our resources to communicate and get ahead of those challenges. So that's what I look forward to. I just look forward to the next day taking care of self, you know, because if I cannot take care of self, I cannot take care of my staff. I can't take care of organization. I can't take care of community. So that's what I look forward to. And hoping that, you know, we can all come out of, you know, this COVID situation the best way that we know how.
Absolutely. Angie, are you back?
I think so. Can you hear me?
So much better.
Okay. I may be speaking like this, but that's fine.
Well, why don't you tell us a little bit about yourself again? And,
okay.
And what were you excited about for 2020, and what are you now excited about? How have those expectations changed?
So, hi, everyone. Angie Martinez, they, them pronouns. I am the HIV program manager at Shalom Healthcare Center, which is a federal qualified healthcare center in the west side of Indianapolis. We do primary care, And with that, we do, mental health, substance abuse, behavioral health in general, and HIV care and prevention. I've been in Indianapolis now for 17 years. No, how old am I? Yeah, 16 years. Wow. Here we are. And I've been working with in the HIV field since 2013, whether it's nationally and internationally, as well as in community with Indie Pride and other organizations in Indianapolis. So that's me. And then 2020, I was looking forward to traveling to Portland, Oregon, and Utah for soccer games, and no, that wasn't possible. So things that I'm looking forward now. I think it's. I'm still trying to figure that one out, and I'm gonna go with that is valid.
That is valid. That is very valid. Thank you. So the title of this panel discussion is community power. And so the first question is, what does community power mean to you, and how have you seen it during the pandemic and also during the events of the last several months?
Oh, okay.
And Angie, you're the only one on. Dr. Darrin fell off there for a second. I imagine you'll come back. If not, you and I can just chat.
Yeah, that's fine. Okay, so can you repeat the question one more time for me?
What does community power mean to you, and how have you seen that in the last 6 months come to light?
So I think it could be a loaded question you're asking here, Chris.
No.
No. So community power to me specifically means a lot. I said it's a loaded question because I am very attached to community. And hence is why I do the work that I do in the clinic that I do it with. Like community means a lot to me. Giving back, being a part of it, having my voice heard, and trying to fight for myself and others in whatever that looks like, right? Whether it's social justice, health, equity, all of that is part of community, so that's what community means to me, and community power means to me. And how I've seen it in the last 6 months, it's been, as everybody knows, it's been a very hard time for everybody, right? We're in the middle of a pandemic. We're in the middle of a lot of tension nationally, internationally, right? So we're dealing with a global grief, a global stress, as well as our daily stress and daily livelihoods. And all of those things are being affected. And community power in the last 6 months, in my opinion, has been interesting because I've seen people showing up for one another in ways that perhaps 8 months ago you wouldn't see it as much.
I can totally see that. I'm not sure if you've had the experience of watching a television program or watching a movie and you see people going out to restaurants or bars or clubs and you're like, why is no one wearing a mask?
Yes.
It just has become a knee-jerk reaction. In the same way with community, what does community resiliency look like, and how have you seen that in the past several months?
I think that as humans, right, we have to be resilient. It's in the power of each and every individual to survive each and every day. Right. And that is resilience to me, or that is what resiliency means to me. Looking in that and looking in what community resilience looks like, although you do see some of those interactions of individuals not adhering to social distancing, not wearing a mask. I tan easily. Let's just go with this. I tan really. I have beautiful melanin skin, and I tan easily. And I have somewhat of a mask tan going on, Right. And you add that, and then you see other people not wearing their mask, and you go through all these things. Being in public health, my priority is with other individuals, keeping themselves safe and healthy, and keeping others healthy, right? I've personally have had, somebody that was in the hospital for over a month with COVID-19, dealing with their life, battling for their lives. I've had my friends lose loved ones and dear ones to that, and I've seen our patients dealing with it in a variety of ways. And resiliency to me have been, even though all of that is going on, people are still showing up. People are trying to do the right thing, whatever that right thing may look like for them. They're trying to do that, and that is resiliency, continuing to try to survive.
Mm-hmm. I totally see that. And look, Dr. Johnson, you're back.
I'm back. Sorry about that.
It's totally fine. I understand technical issues all the time. We were just talking about what does community power mean to you and community resiliency mean to you, and how have you seen that in the last several months?
So community power means, to me, means acknowledging the diversity that we have within our community. We often talk about diversity, equity, and inclusion with, and sometimes with no intent to achieve it. So it's looking beyond these conversations and making sure that we are intentional about what we mean when we say take care of community and what we mean by diversity, equity, and inclusion. So looking at the differences and the nuances within the LGBTQ community, I often talk about, from a place for Black LGBTQ plus people. So I want to make sure that I bring that into the conversation, but just making sure that we honor, acknowledge, and value those differences. In terms of resiliency, I think this is growth and adaptation within our community, utilizing resources, coming together, and making sure that we take care of one another is what I think of when I hear of resilience. Again, this year has been so challenging with COVID. It's impacted our finances, it's impacted our work, it's impacted our families. We've lost a lot of people, but there, are many of us that continue to move forward, and we continue to take care of ourselves and our community, and that is resilience, and that's what we need to continue to do, and that is the way that we're going to come out of this.
Dr. Johnson, you said at the beginning, we talk a lot about diversity, equity, and inclusion. We have no intention of actually making any changes. Can you unpack that a little bit? What did you mean by that? What have you seen? What have your experiences been?
Well, we're having more conversations about race and equity now, mm-hmm. And these are great conversations. But I think that now it's time for the hard work. We need to talk about and understand racism, and what that means. The experiences of people, particularly people of color, particularly Black people in our community, and how that has impacted us in ways that we have not been able to talk about. And part of that conversation has been sort of swept under the rug in the LGBTQ plus community. And I think it's time for us to be open and be transparent and lead with race. I think some people are so afraid to bring up the topic of race that it's almost ridiculous. And I would encourage people to lead with race, because that is how we understand people's backgrounds and cultures and experiences. And that is how we move forward, and that is how we learn.
Thank you. I appreciate that. I kind of want to stay on that, if that's okay with both of you, for just for a few minutes. I mean, we've got lots of time. What are some intentional, practical steps that LGBTQ organizations, that other organizations could take that would meaningfully impact their understanding of race, their practices around that are maybe discriminatory or prejudiced or systematically racist? What are some practical things that people could do? And I'm going off script here, so forgive me if I'm not phrasing it correctly.
No worries. Fine. So I think, from my perspective, Black folk have always, been, talking about race and leading with race and talking about our experiences. And we've been angry, we've marched, we've had conversations, we've taught, we've educated folks. And I think it's time for white folks to do the same and have conversations about, power, the topic we're talking about now, privilege, race, and systemic racism, and how it has, has benefited parts of the community and not benefited other parts of the community. And I think, we start with conversations. I mean, I think that's intentional, being upfront and forward about really having the hard conversations is something that's intentional. And I think, after that, we take steps to make changes. We look at policy changes within our organizations. We look at policy changes within our community. We look at how things are funded within our communities. Who are we taking care of? We often say, folks impacted by disparities or the underserved communities. Well, really, what does that mean, and why are these communities underserved? And why do we keep saying that without, looking at steps to make sure that these communities are not underserved? These are often the people who have access to the resources that name, these groups of people, these populations deemed underserved. So, what are those folks doing to make sure that they are taking care of these communities? And I think, these are things that we just don't change overnight, right? We have to, start with the conversations and have, have meaningful involvement of people and folks who are impacted by, these challenges and these disparities, including systemic racism.
Thank you.
And I mean, first and foremost, if anybody hasn't heard Dr. Johnson speaking before, welcome. This is always a treat. I adore everything Dr. Johnson always has to say. So it's always great, and I'm always learning from him. One of the things that, like he mentioned, like we talk about privilege, we talk about systemic, racism, we talk about the biases, and we know the systems operate this way. We know that it is how it is, right? And we're like, we want to change this. So what can we really do? And like, we are constantly fighting that. You always see, Black, Indigenous, people of color in general having to deal with this. You see white, Caucasian individuals dealing with this at the same time. This is not a problem just for Black individuals. This is a problem for all of us in a variety of ways. Like it is hitting all of us. So what can we do? And it starts with you, starts with me, starts with each and every one of us being uncomfortable and acknowledging it, right? So when you say, what steps can we take? It starts with you taking that first step and acknowledge it, and you doing the research, and you saying, how can I make myself better to make my community better, right? So if we don't take that first step to try to acknowledge our privilege and our bias, then what are we doing? Right? How are we going to make a change if we don't start with that? So, and then when we talk about privilege, and we have to understand the privilege looks a lot of ways. The privilege is the lack of access to experience sometimes, right? So how can you have that experience? Well, go out there, read a book, ask questions, ask yourself those questions, right? And once you start doing that, then we can, if I do that and you do that, then together we can start making those changes, right? And I see it in the way we look at the systems of change we're trying to create, whether it is in organizations that are serving our queer communities or organizations in general, and the government systems, but within ourselves. Like if we're doing those little things, we can start chipping away at these huge issues that we have, right? And that's how I look at it.
Yeah, thank you both. I mean, I completely agree as the white guy on the call that I think it's up to us as white people to educate, to talk to have these difficult conversations and stop relying on the people in our workplaces, like the one Black person in the room and stuff like that. Like it's up to us to start speaking up. So I hope that this is the first of many conversations about this, but we talked a lot about resources. What resources are available that you're aware of, that you promote, and that your organization provides. So let's start with Dr. Johnson first.
So, BU Wellness Network is primarily an HIV prevention and linkage to care organization. So we provide HIV counseling, testing, case management, support groups, prevention education, linkage to care, all of those services to take care of people impacted by HIV. With COVID, we've had to expand our resources beyond just taking care of people living with HIV, but, folks impacted in a number of ways. So we've received funding from our community partners, United Way, the Health Foundation of Greater Indianapolis, to provide emergency financial assistance for people impacted by COVID. So we're providing rental assistance, housing, emergency housing, utility assistance, food vouchers, food access to food pantry, food boxes. So any type of essential support service that we can provide to take care of folks during this time is what we're doing right now. And in addition to providing support, to our HIV community.
Angie?
So for Shalom Healthcare Center, for example, we are a federally qualified healthcare center. For those that don't know, I'll bring it in different terms. We are a clinic. We do primary care and everything that goes within primary care, as I had mentioned previously. So we do HIV through the continuum of care. We do primary care from, acute and chronic illnesses and diseases to behavioral health. We're an outpatient substance center. So we are able to pretty much do what we call a patient-centered approach. So anything that our patients may need, we try to find a way to help them with it, right? And we do that by our 2 clinics on the west side. We have 2 of our big clinics, and we do pediatrics to adult on it. And then we also have 26 school-based clinics as well throughout Indianapolis. So we're doing a lot, throughout the city. While we're doing a lot, we also have a lot of community partners. We have to have community partners. We have to work with them because it takes more than just us to try to do what we say, the patient, patient center. Our patient may need things that we may not be able to give them, but that's where our community partners come. So we partner with, for example, BU. They're one of our community partners as well as other individuals in the city. And then we offer all the other supports. We have a social worker within our staff that works with us, and we try to help our patients with whatever we can. Whether it's when we're looking at HIV in my program, with free testing, PrEP, PAP, medication, and any of the assistance that go with them, the linkage to care within other partners and organizations, primary care from diabetes, and people that aren't able to obtain their, insulin. We try to find a way to do that. We have a great pharmacist that helps with that. So it's really a wholesome care. And now with COVID, also that, trying to figure out how we can help and work with that, from the testing to the associations of what that means and how we can better help.
So I'd like to use this as an opportunity for all of us to learn, because we had a question come in, and I'm hesitant to ask it, but I'm just going to throw it out there, and maybe this could be a learning experience for all of us. Someone asked, what does an ideal, with respect to the conversation we were having around race earlier, so this is about the racial issues, what does an ideal end result look like in action, having actionable goals that change the norm, having actionable goals that will change up the norm? So my take is, and forgive me if I'm completely wrong, is that I feel like that question's been asked of people of color, BIPOC folks for a long time, but you're the ones that are being, that are on the other side of it. And if it's the white folks that have caused the problem, shouldn't the white folks be the ones that come up with the solution? In a sense of, I'm hesitant to just put that on you and say, okay, so how do we fix this? Like what actionable steps can be taken? But I'd like your thoughts on that.
So I'm going to agree with you. You're right. Even though, in my role, I think it's important for me to lead these conversations, especially when they're not happening. For example, I do conference, presentations and meetings with other practitioners and providers who take care of, Black folk within their organizations and provide services to our people. But I do agree with you, right? We've always had to have these conversations, and it's really not our place or our jobs to do so. It is now the responsibility on those who have oppressed us for so long to fix and find the solutions and create goals. However, that doesn't mean that we stop having the conversations, because for a while, we're going to always have to bring our experiences into, whatever space we're in. We're always going to have to take care of our community, and we're always going to have to make sure that we call out bias and racism as long as we have these systems that exist. Uh, but I think, we have to look at it in different ways. There's a multifaceted approach here. There's micro approach and there's macro approach. We got to look at ourselves. We have to look at our families. We have to look at our communities. We have to look at the places in which we work. And we have to look at all ways we operate to see how to make changes. So although I really like the question, it's sort of, broad, right? We have to look at the different approaches and how all of the places we show up, how we how we intersect and how we engage in those spaces. So hopefully that provided some context to have a much larger conversation or ongoing conversation, but also to think about self first, but what you can do with yourself and in the spaces that you operate to start to make change as well.
I agree with what Dr. Johnson says. So, when you look at that, I throw it back like, I'm gonna say the question is, what does the ideal end result looks like, right? So like that question is like, okay, so we end racism, right? Like let's look at that. What comes next? How does that look? Like, can we fix it right now between the four of us and whoever joins us? And then, like, if somebody has the answer, please put it in the chat. Let's do it, right? So, like, those are what does actionable goals to do that comes in. It takes all of us again. You know what I mean? You have to reevaluate where you stand and when you have to speak and when you don't, right? When one of the things I always say for myself and others is like, I have to hold myself accountable as well as you accountable. Like we have to hold each other accountable. And one of the things you said, Chris, is like, you mentioned like, that's why people listen to us to clean this up. Yeah, you made the mess. If we look at that, you made the mess. You can have all the cleanup, but it's going to take all of us to do it, because if you clean it up, what does tell me if you're not going to learn from cleaning it up, possibly? So let's work together on trying to clean this mess up, right? But you may be paying for it because it was your mess to create with, right? We can always have that, but that doesn't mean that it's not going to take all of us, but I'm still going to hold you accountable for it, and I'm going to acknowledge and commit to dismantling all the underlying racism and the identity-based stigma that comes with all of it, right?
Mm-hmm.
So,
well, Dr. Johnson was frozen in a very funny expression while you're talking, and I was like, is he just being really still, or is his computer frozen?
Technology, don't we love it, right? But I think that it's what does ideal end result or actionable goals look like? It's the accountability. For me, at least, I cannot speak for anybody. I cannot solve this problem. It's a big problem, and it's going to take all of us. So it takes the accountability for all of us, and we have to renew our commitment, to this drive to end these inequities, right? Because we look at racism, but there's more than just racism, and it trickles down to a lot of other things that come from it.
Well, oh, absolutely, and I think that a few things that one that's community power is about this is that already the BIPOC communities have found power within their own community, but as LGBTQ people, to listen and to join in and to be part of that power as we face a global pandemic, and finally folks are listening to the systematic racism that exists within law enforcement and our social and our criminal justice system. And so this is an opportunity for us to join, to participate, to support, to lift up the leaders' voices. And the other thing is that, Angie, I don't know that a lot of people know how much work you put into the Pride board and into Indy Pride itself, and how much of a debt we owe you, because there were lots of times that we were in the room and there was a lot of uncomfortable things being said, not directly directed at you, but just the spirit of it was probably something you didn't agree with. And the way that you sort of changed Indy Pride was that you came in, you sat, you participated, you became a festival director, you worked your tail off for years and years and years, and you gave your heart and your soul, and to the point where you demanded the respect, and your respect was earned. And then, and I'm not saying that is the way that it should have been, but that's what happened. And so I'm grateful for both your leadership and your friendship, and the power and the resiliency that you've taught me since being part of Indy Pride. So,
well, thank you for that. I'm not uncomfortable whatsoever. But I think that just goes to show that we can't have sorry, how do I phrase this? That just goes to show that, for me at least, that's not the first time that's happened.
right.
Let's start there, right? That's not the first time that it happens. And I hate to say that I know that won't be the last time that will happen. Things like that with individuals of color, with the marginalized community, and there's different layers of it. It's a queer, immigrant, trans, all these other identities that are a part of it. There's different levels of privilege that comes with it. So there's different levels of extra work that you have to do to prove a point.
Right.
I know what I'm talking about. Yet if somebody else steps in it, automatically they will know more about it. Automatically. Right. And we look at it like in healthcare, like we look at it as systematic racism and whatnot, but it's more than that trickles into it. We look at healthcare, and we look at the, back to something that Dr. Johnson said, we talk about all these inequities, right? We look at the health inequities, and I'm passionate about that as well, just as I am with, queer and social justice. But we look at those, and sometimes even I'm in the room where, whether it's me or somebody else, and my healthcare provider will think that they know more about me than I would ever know. So, and this happens with a lot of our patients. We see it, we know it's a fact that, for example, Black individuals, their healthcare providers may not give them the medicine that they need because they don't trust that, because they have all of these biases addressed to them. So just like I am in this, board of directors in this room trying to fight and earn their respect that I know I deserve. I know that I have to have. I know that it's mine, whether you validate it or not, right? And I'm not saying you, Chris. I'm just saying you.
I didn't take it personally.
But the same thing happens in and out in healthcare. Mm-hmm. You're seeing the same things happening with, the patients in the community that we serve. When you have a Black trans woman walking in and asking their provider for a test, any kind of test, and the provider not knowing how to, address them, not knowing, like from that get-go, you see that. So they have to prove themselves and earn that respect, and they shouldn't. the minute they walk into the door, that respect is already there.
Absolutely.
And that's how it should be. So I continue to work with that. And I'm thankful for community partners and community leaders, as yourself, Chris, as Dr. Johnson, where we continue to fight for that and thrive so that that happens, so that our community is validated. They don't have to earn the validation. They are valid, period.
Mm-hmm.
So let me ask this: does it do? What are the effects on people's mental health when they're pursuing the resources that you offer? Do you find yourselves having to overcome any stigmas or anything like that from people seeking services?
Well, absolutely. Particularly with BU Wellness Network, because we are historically an HIV service organization. So, of course, there's still stigma as it relates to HIV in 2020. But we're also an LGBTQ plus service organization, and primarily a Black LGBTQ plus service organization.
Right.
So there's stigma around that, and who we are and how we show up, and perceptions of our within our community. So we have to address those head on, but we also have to be unapologetic, right? We are Black, we are Black and trans, we are Black gay, we are Black and bisexual, and we are here to provide services to the community. Period. So that's the first thing. The second thing is we understand the challenges around mental health, that folks, show up with when they come in. I mean, even those of us who do this work have challenges with mental health. So we just want to make sure that we are addressing the needs of our clients as they come to us. We've seen an increase in mental health referrals and mental health intakes since COVID, with folks, having to self-quarantine, and being in isolation and not having the in-person contact with their friends and family. Folks need the support, right? So we've been fortunate to provide mental health services virtually. We've been fortunate to provide our support groups virtually. We've been fortunate to provide virtual drop-in centers to make sure that people have those connections that we all miss meeting in person. But mental health is important. It is something that we all need. It is significantly underfunded when you talk about funding and resources and resource allocation. But we do the best that we can with the resources that we have, with community partnerships, and with the support of my wonderful staff to keep these services going.
Can you repeat the question one more time? Because I was really paying attention to Dr. Johnson. I was like, yes, go be you.
I don't even remember the question. That's how compelling Dr. Johnson is. I'm kidding. It was really revolving around stigma and seeking services in general. I've worked in social services for years, and always overcoming stigma so that people can get the resources they need. It was a lot of an issue that I dealt with. So I was wondering if there's anything that you can say about that.
Yeah. So, for example, we see that within our patients. Like I said, we offer mental health and behavioral health in general. And at Shalom, I always say we serve. I'm very lucky to serve the community that I serve. We serve the underinsured, uninsured. So we are constantly serving a lot of the marginalized individuals. We're located that's what part of what makes us an FQAC. So in order, honestly, to work in an FQAC in the community that we serve, you have to have passion and heart for community to do that. So you get to see the beautiful things in community and also the really ugly things that affect community, like mental health, right? And when you're looking at that, like we've seen an increase, and you can find reports and you can pull up the data, and you see, for example, substance abuse. With COVID-19, a lot of substance abuse is spiking. It people are, trying to do what's best for them, or what works for them in isolation, right? And that looks a lot of ways for some individuals. Some may be seeking therapy, some may be seeking, alcohol or other drugs and whatnot. So we've noticed an increase on that. We've had to expand our services in how to try to come to them as well. Because it's not, we can expect our community and our patients to just come to us, but also us having to come to them. And what does that look like? How can we make that happen, right? So it is a lot of that back and forth. And like, for example, with us, um, we are having a mobile unit. We're actually bringing out a clinic out into the community. And there's people that aren't able to come to the clinic to talk to their mental health, to get their medicine, to talk, to be in therapy. Uh, they're trying to, they're no longer using drugs, or no longer want to use drugs, and trying to get the help that they need for that, or they need help with COVID related things. People are losing their jobs, and we're able to provide other services for them to try to help them. We have a community COVID help that we're offering to our patients. So how can we get that to them? Right, because they may not be able to come to the clinic, and adding that stress of, oh, I need to go get my insulin, oh, I need to go get my, prep, I need to get my labs, or I need to, get my hormones, whatever that looks like, they may not be able to come to our clinic. So we have to get it to them. And we have to figure out ways to do that, whether it is with our mobile unit, or whether it is with our partners, and saying, oh, BU is closer to you. They're offering their services. Go to them. We're having those referrals to them. And it's a constant, like, how can we help our patients in our community when they're already dealing with all these other mental health issues? And if we can take a little bit of that stress out of them, we're going to try.
Excellent. I guess the question is, what have been effective responses to the pandemic that you've seen from either your own organization or other organizations? Like, what has made a difference in people's lives that's been meaningful and impactful as we're dealing with isolation, mass, job loss, evictions, everything? Like, what are effective things that folks are doing?
I think continue to provide, support and connections to other people. I think our virtual drop-ins and support groups have been, more important now, more than they've ever been, because people really need those connections and want spaces to talk and, just and support other people as well. The other thing is, having the ability to provide emergency financial assistance, or just financial assistance for people impacted by job loss, um, you know, who need support around rent and utilities, food access. I mean, those things have been extremely important. And then the other thing is having PPE to give to the community, with the mandates, with the face masks, especially with people who might not have access to purchase them, or have limited access to purchase them. We've been able to distribute face masks and hand sanitizer, hygiene kits, and things like that to the community. So those things are important. They're going to continue to be important, and we hope that with our ongoing partnerships with our community partnerships, we're able to continue to provide those resources.
Yeah, what Dr. Johnson said. I mean, we've noticed community coming together in a variety of ways. We a lot of, like I mentioned, we have a lot of patients that come to us for a variety of reasons, whether it's medical and sometimes not medical, right? And we're trying to have them and get that connection. And we've had a lot of different community members actually sewing masks, and donating them to our healthcare center, so that we're able to provide them to our patients in the community. We've had to food drives, from grassroots movements and individuals, donating to local food pantries, to organizations making food drives, and doing that and dropping them off, and mobilizing to saying, okay, we're having this pop-up food pantry in this location, or we're expanding our hours in our food pantry here, or, oh, you have patients that need that that food drive, how many bags or how many boxes do you need? And then we can make that. So a community, once again, coming together to try to work with organizations and different leaderships to provide all the help that needs, whether it is GoFundMe, whether it is a variety of resources, whether it is, even like local, like babysitting each other's kids sometimes, or like having to like find ways to do that, from grassroots organizations, individuals, to leadership and big organizations.
I hear a volunteer for babysitting, so we'll put your email address on there, which would be fantastic.
I'm sure.
If I'm watching and I want to support your efforts and work, what is the most effective way to support your work and the most appreciated way?
So go to at BU Indianapolis on Facebook or visit buwellness.org. Volunteer. Even though most of our services are remote right now, I'm in office right now, but we are still in office and we need support, making bags for the community where we put our hygiene items, our masks. So we want to get as many bags as we can made. So volunteer opportunities are still available. And also, look at our social media for other opportunities with other organizations. We oftentimes share what other organizations are doing to support the community as well. So, be a resource, be a volunteer, share the information for folks that need it, but also, come help us out.
Great.
Yeah. For us, I have to say this: wear a mask.
Wear your mask.
Practice social distance. If you feel sick, don't, isolate, contact your medical provider. If you don't have a medical provider, call us, Shalom, or visit our website, visit other website, visit the state website, reach out to other organizations, BU, they will recommend you to somebody else. So take care of yourself so we can take care of each other, right? Absolutely. So that's the first thing I'm going to say on how you can support us, right? And then in other ways is, you can visit our website. You can visit us on social media. We just got on Twitter, Shalom Indy, Shalom Health Indy. You can find us on Facebook, also www.shalomhealthcarecenter.org. You can find us there. You can find me. You can email me at hiv@shalomhealthcenter.org. Reach out. I'll try to help in any way I can. And just try to do the best thing that you can for yourself. You can look at other organizations and you can donate money to us, donate money and time. Try to find different ways. Like I said, we're still giving masks. So if what you're able to do is provide masks, you can throw them and donate them to other organizations that are doing it like we are. So is BU. You can drop off masks there and we can make sure that people that need them, we can get it to them, so just there's a variety of ways, different resources. I know Indie Pride has some resource guides there, so you can look at those as well to try to help each other on.
Thank you. And if anybody's watching, you can submit questions. The last question that I have is personally, what has been something that's helped you survive in your own personal mental health this pandemic?
Meditation.
Medication.
Medication. Also my Lexapro. I have anxiety and Lexapro also helps. Meditation is personally what has helped me. A lot of times, it's a stressful time, and it's not just like, I think it's in general, personally, it's a stressful time. And then working within healthcare, there's additional layers of that. And so there's all of our different identities, right? We all wear different hats. But meditation for me has been what has carried me through some, tough times, and saying, okay, I need to center myself. I need to figure out how can I be my best me so I can be my best me for others. What does self-love with accountability looks like for myself so that I can be able to provide that for others. I see that therapy as well, talking to my therapist.
Sure.
That has worked. And then community with my friends, with my coworkers, trying to figure out what's the best thing that we can do and just providing that, laughs sometimes with each other, with friends. That's for me.
Excellent.
So, I've gotten into this mode where I'm just wanting to make sure the organization is good and we're taking care of community as much as possible. That I haven't done the best job with taking care of self. However, sometimes I just take a step back.
Oh, I think he may have.
I think he might have frozen. So
Yeah.
With that, we'll give him a few minutes to come back on, but I get that. I don't see a lot of questions. There's really no questions coming in. So I wanted to, I appreciate your time and thank you. And I'm sure I will say this again if Dr. Johnson comes back on with us, which I think they probably will. But we are kind of gone through a lot of the questions.
Yeah. I think I see some questions, Chris.
Do you see questions? Oh,
I do see questions.
I don't see any questions.
So I'm gonna read one question, and it says, Tiffany says, there have been a lot of recommendations for personal research out there. Do you have any books that you personally recommend that have been impactful or meaningful to you? So I can answer this in a variety of ways. I think this may have been a little bit earlier. That I personally recommend. I've read for myself, and I've read for myself like for pleasure and for professional and for community. So I'm like constantly reading. If I don't have an Audible, I'm reading. So I mean, always. One of the books that I think have helped me a lot, and I think people have been reading them, White Privilege. That's why I love reading different articles, not just even books, but different articles. Like for example, from Dr. Ibram Kendi, and he's, for some of you who may have read his book, How to Be an Anti-Racist. One of his articles, it's called Who Gets to Be Afraid of America? It's a great article that he wrote. Peggy McIntosh, White Privilege, Unpacking the Invisible Knapsack. Great read as well, as far as articles. Dr. Johnson, there was a question that was asked about recommendations for personal research for books. Let me see. Redefining Realness by Janek Mock. And then any Audre Lorde, honestly, for me. I know I threw a lot of them, but those are some that I really enjoy and recommend.
I have a list of recommended resources that I can send, and hopefully we can get that out, or we can post it to social media so we can get that.
We'd be happy to share that. Please. One question: as leaders, what's one thing that you would have done differently this year? What's one thing that you wish that you would have, in hindsight, just done differently?
Invest in Zoom. Right. For my organization, invest in Zoom. That would be great. I'm gonna let you take this one first, Dr. Johnson. I'm gonna think about it.
Well, along those lines, I mean, just having, a plan B. I think, none of us could have imagined moving all of our services to virtual platforms. So just making sure that, there's some type of backup plan. Many of us, we had, widespread illness plans, or we had to revamp it and expand it. But, that's something that I would have done differently in planning this year in budgeting.
Yeah. I remember, especially in March and April, there was such a sense of collective pause and trauma that it felt almost impossible to think, to plan, to grasp the seriousness and longevity of the situation we're now in. And so I think that I wish I would have moved a bit quicker.
And I think it's hard when you say just one thing, right? Because a lot of things pop into mind constantly, and that may change, right now than it was last week or tomorrow, because something in the communities we serve, it's a constant change of the needs. The needs don't always look the same. So whether it is for their organization or a patient. So what my need was prioritized today may not be tomorrow. Like, do we have enough PPE? Could we have had more PPE? What does staffing look like for us? How do we keep our staffing safe, right? And then you ask those questions of, was I keeping my staff safe beforehand?
Right.
What's that back and forth? So you're constantly questioning yourself, and then not only my staff, but is my staff safe? But are my patients safe? How can I continue to provide those services for my staff? So I don't think it's just like unfortunately, one thing. It's like a constant things of like, what can I continuously do different, but continuously improve?
What are the? I'm sorry, Dr. Johnson. I'm interrupting you, am I?
No. I was agreeing with
Okay.
Dan.
Okay, good. If someone needs an HIV or STI test, what's the best way to schedule an appointment? Do you have walk-in hours? What's the best way to go about that?
So at BU Wellness, all of our appointment. So we're only doing testing by appointment. You can do that by going to our website at buwellness.org and schedule and just select the time. You can also call us 317-931-0292 and schedule an appointment with our intake coordinator. We are testing Monday through Thursday, 10:30 to 5:30, and on Fridays we're testing from 10 to 1:30. So we're testing daily, and we can also make appointments by weekend as well.
Excellent. And we'll get that information out as well in the chat box and stuff like that.
Yeah, in Shalom, we have walk-in services. Both of our clinics are open on 56th Street and Lafayette Road, as well as on 34th Street and Lafayette Road. And you can walk in, you can schedule an appointment. You can either call us 317-291-7422. You can call and make an appointment, or just walk in and say, hey, I'm here to get a free HIV test. We are also a part of there's like Acuity Schedule, it's called, and you can look at it online, and they have Facebook ads. You can direct message on Facebook, just like I'm sure you can with BU, and they will send you to where you can schedule an appointment that may work for you on our open hours. Our clinics are open from Monday to Friday, and we have a variation of days. So we're open from like 8 a.m. to 7:30 or 7 p.m. on different days, except from Friday. So you can come in and get, a free HIV test.
All right. Well, thank you very much, Dr. Johnson, Angie Martinez, our ASL interpreter. We appreciate you coming tonight. I think we're going to wrap up there. So again, thank you so much for the work you're doing in the community, for being with us this evening. And we will be certain to share a lot of the information on our social media channels in the coming hours and days. Thank you.
Thank you.
All right. To the rest of the community, we have a couple of Indie Pride announcements coming up. First, if you would like to become a member of Indie Pride, membership is absolutely free now. You just go to indiepride.org and fill out the membership form, and you will be part of the Indie Pride community, which gives you the ability to get first crack at some of the things going on with Indie Pride, to vote, and to join our board. We are now accepting applications for the Indie Pride Board of Directors until the beginning of September. So please check that out if you're interested in being part of the Indie Pride Board. We have a few upcoming events. Our virtual First Friday Spectrum 3 event is on September 4th from 6 to 8 p.m. It is an LGBTQ art exhibit happening in partnership with Garfield Park Art Center, who will be hosting an online visual arts gallery and live stream musical and performances. Check out our Facebook page for details. And also, we're going to the drive-in. On Saturday, September 12th, starting at 8 p.m., we'll be watching the movies But I'm a Cheerleader and Dear White People. Tickets are very, very limited, so I encourage you to sign up. And we will be having HIV testing on site there. Feel free to check us out on Facebook, Twitter, and on, what's the other one? Instagram. Anyway, have a great night. Thank you so much for being with us.